friends. I hope you guys are having a great day. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about how to get rid of that pinching pain in the groin. So we get a lot of people that come in with uncomfortableness, either a pinching, a stabbing, kind of in that front groin area or maybe even in between the legs. It's a very distinct, almost feels like something's getting caught. It's a pinch. Sometimes that pinch can cause a shot down the leg, but this isn't a diffuse pain, meaning you're not going to feel it all over. This is what we're talking about tonight, is a pinch. It's something getting caught. It feels like something's getting caught, but you're going to feel a pinch and it'll stop you in your tracks. This is a very severe pain that you're going to kind of have to, maybe shake your leg or, stop what you're doing. It's generally not debilitating, meaning it goes away after a few minutes, maybe even an hour or maybe even a few seconds, but it does stop you immediately and, take your breath away. And it can be reoccurring it can be reoccurring, which is why we're going to talk about how we get rid of it, because it's something that, while it's not completely debilitating, it does stop you in your tracks. So, well, first thing we want to talk about is whenever anybody talks about this pinching pain, either in the front of the leg or in the middle, right in between your legs, they just want to concentrate on stretching that area. So they're going to do a lot of hip flexor stretches, really concentrate on that area, when in fact, a lot of times it is the entire hip that's being affected. So if you are doing these hip flexor stretches, seeing a lot of results, it's because you're ignoring a lot of what else is going on. So important, you need to treat. So if you just focus on that area of where you feel the pain, you're not going to get a whole lot of result. You're just going to feel that pain. So we're going to show you some stretches. We're going to show you some things you can do. Some of them will concentrate directly on the area. Most of them will concentrate more around the area because, like I said again, it's important to treat around the area as well as directly. You are not, most of the time, going to get results if you're just doing this stretch. Now, if you feel this pain more than once, there is something going on. Sometimes people feel this, will say they feel this pinching pain once, they do a couple things and it's gone. If you remember the last time you felt this, you really need to get in to see someone. This is a very small sign of something to go wrong. It goes away after a few when it starts. So don't ignore this. This is a very small but subtle, well, not even subtle, but it's a small warning sign that something's about to go really wrong. So make sure you get this treated by a professional, not just do a couple of home stretches. So the first thing we're going to talk about is actually doing that stretch right to the area. So you're going to start with your legs spread. You want your toes pointing forward, all right? And you're just going to lean to the one side. So the leg that stays straight is the leg that you get the pinching pain in. Now, you're going to want to do this both sides, so it doesn't matter really, but you want to make sure that the leg that you're stretching is straight. Now, if you don't feel anything with this, you can put this leg that's straight up on a step and bend a little bit deeper to get that more enhanced stretch. You want to hold that about 30 seconds and you want to do 6 of those, okay? But again, if you feel pain or it starts to pinch, don't just stop and don't continue, all right? But this is kind of where you start. You want to just go down until you feel that stretch. A lot of people are going to feel that stretch right as they start. Important, your toes are out like this, you're not going to get much of anything. Also, when you're in this stretch, you don't want to be moving around too much, okay? That's not the point of the stretch. If you're not feeling stretch, again, put this leg that's straight, up on a stool, up on a step, lean more into the lunge. If you still don't feel it, don't worry about it. It's not something you're definitely going to feel. The next stretch we're going to talk about is we're going to talk about the figure 4, which we talk about quite often, but it's really important for that hip complex. So what you're going and you're just going to cross it over, all right? Now, you're not going to feel this anywhere in the front of the hip, generally. You're going to feel this more in the glutes, in the hamstring, and that's okay. You're not supposed to feel it here. Sometimes people can complain of a little uncomfortableness here. If it's painful, stop, but you want to just sit up nice and straight and you want to lean forward. You can do this one sitting, you can do this one standing. On our YouTube channel, Total Performance Physical Therapy, you can see lots of versions of this stretch, so I'm just going to show you the one sitting. But you're going to sit up nice and straight and you want to lean forward. again, you may not feel anything with this stretch, but it's important to address the entire hip complex. I'm going to show you two more things. The one is going to be a stretch. So this is going to be where you're going to lay down on your back and you're going to stretch the front of the thigh. So what you want to do is you almost want to have your leg hanging off. Now, if you're getting any pain or any problem in your low back, stop this stretch immediately. But this is a good stretch just to allow gravity to lower that leg down. Again, holding it 30 seconds, doing about 6 reps, just gently bring your leg up. If you get that pinching pain as you bring your leg up, you want to discontinue this stretch also. Angle a little bit, you should feel a stretch in through the front of the abdominals, even into the front of the thigh, maybe even into the quad, into that hip flexor area. All right, take it nice and slow. You may pull your pain. This is a tough position to get your leg up from. So if you're having trouble doing that or it's causing you pain, use it of soft tissue work. So I'm going to show you what you can do with a beastie ball. You can do this with a tennis ball. You can do this with a golf ball. This is the most effective on the area. But all you're going to do is literally sit on this ball and roll around, okay? So we want to roll all over here, all right? In the back, all the way over. You can lay on your side. You can do it with your hand and start to do it here. And then you can actually fix the problem. If you or someone you know is suffering from hip pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.